I'm Joel.
Kathy Jenkins.
Dustin and Harley.
Imagine that you still have 10 weeks left to go in your pregnancy, and all of a sudden you feel a leakage coming out. Could it be that you've urinated on yourself? No, you are in labor and your water has broken, and you still have 10 weeks to go in your labor. Hey, my name is Heather Coleman, and I chose to talk about premature deliveries today because my niece was actually born 6 weeks early. As a result of this, she did suffer from undeveloped lungs, and we were not able to touch her, hold her, or even talk to her due to her underdevelopments. Today I want to inform you on why premature births occur, as well as the effects it has on the mother, the child, and how they are able to cope and deal with the situation. Premature births have been on a steady rise since the 1980s. In the 1990s, almost 476,000 premature births were delivered. And premature birth deliveries are babies born from as early as 30 weeks up to 36 weeks, some even sooner. Premature deliveries are not necessarily caused by anything specific. It can be a result of a history of the mother or even situations that arise during the pregnancy that doctors do discover. However, almost half of premature deliveries give no signs or symptoms that the baby will come early, which makes it hard to detect it and solve the situation. The most common issues that a baby has during premature delivery are breathing problems, staying warm, feeding, and jaundice. Preemies have very little body fat to keep themselves warm, which oftentimes causes them to have to be in an incubator setting. They also have breathing and feeding issues, which would cause them to be on a feeding tube and a respirator to help them breathe. Another big issue is jaundice, which is a discoloring of the skin and can be very severe in babies born before 36 weeks. Now that I have informed you why premature births occur, I want to explain to you how the mother deals with coping with this situation that is so sensitive and difficult to deal with. A premature baby will typically stay in the neonatal intensive care unit for the amount of time that they are early. If they are early 6 weeks, they will likely stay 4 to 6 weeks in the neonatal intensive care unit. As a mother leaves her baby in the NICU for several weeks, there is a difficult loss of bonding time between the mother and the child. The most common effect of leaving a child is anxiety or depression. A mother may begin to experience separation anxiety from not being with the baby. She may also develop postpartum syndrome, which would cause her to become apathetic towards the baby and not necessarily care as much as she would have had she had the baby home with her. Having a baby in the NICU can provide extremely difficult situations. The baby can have many medical issues that need to be addressed and can even result in surgery as a result. The baby also suffers from separation anxiety from its mother. It is completely aware of its surroundings and the nurses and doctors treating the baby and its infant's parents. There are many ways to cope with these difficult situations and that are involved in having a premature baby. In the book Kangaroo Care, the author suggests that bonding is one of the best ways to deal with a preterm delivery. Bonding is an activity between the mother and the child that takes place immediately after the birth. The baby has an opportunity to learn the mother's voice, her smell, and even her touch. Having a baby in the NICU prevents that initial bonding that you would get with a full-term labor baby. It can also make her miss the opportunity to bond with the child. Kangaroo Care is a program that allows the mother and the father to get that bonding experience so they don't miss out on it. Many difficult situations can arise, and ways to take care of this when you're bringing the baby home is to have people around you that support you, that can help you make these decisions and keep a clear head throughout the situation. However, there still may be feelings of anxiety and inadequacy to be able to take care of the baby when you bring them home. Before being released from the hospital, the doctors will perform their assessments and tell you the care instructions that you need to have for caring for your neonatal intensive care baby. The Essential Guide for Parents of Premature Babies suggests several do's and don'ts. These include: do not take your preemie outside, avoid crowded environments, keep small children from visiting your baby, always wash your hands after contact with germs, Wash your toys, your pacifiers, and bottles regularly, and make sure you have a car seat that is specifically designated for a premature baby. You should also purchase special diapers that provide a specific size for your newborn baby. There are also pediatricians who specialize in dealing with the issues of a baby that has been through a neonatal intensive care unit. In closing, it's hard to imagine that you would ever have to go through such a tormentive situation, but remember to stay positive, always ask as many questions as you can, and build up a support system for yourself and your family. There is no way to prevent a premature birth, but it always helps to have a healthy pregnancy and go to your doctor regularly. I hope I have taught you more than you knew before this speech about premature babies and their effects it has on the family, as well as how to cope with these situations.